She is the Senior Manager of Public Affairs with the Canadian Cancer Society, and she began her work early in Westminster, England, in the office of the Deputy Leader for the Labour Party. After moving to Canada, she worked for several members of Parliament, eventually taking responsibility for legislative affairs under the former NDP leader, Jack Layton. And coincidentally, while working for the NDP, she was the Vice President of the Communication, Energy and Paper Workers Local 232 and Vice Chair of the CEP Ontario Women's Committee. Please welcome Lauren Dobson-Hughes.
The Canadian Cancer Society is one of the largest health charities in the country. You probably recognise our daffodil emblem. Perhaps you're one of the hundreds of thousands of Canadians who've participated in a Relay for Life, contacted one of our local offices, or looked up information on our website. But we're more than research, and we're more than services. We're active advocates for preventing cancer and improving the lives of cancer patients and their families. And this is where we actually have a lot to learn from the labour movement. You are all pioneers in improving the lives of workers, and rank-and-file members like you have fought long and hard for better sick leave, maternity pay, health benefits, and safe workplaces. And these are the issues that I'm going to cover today. Because your work directly impacts cancer patients, because tackling the issues that you deal with every day prevents cancer and improves the lives of those living with and beyond cancer. So you know as well as I do that workers have the right to a safe workplace, a workplace free from harassment, a workplace where you're protected from dangerous chemicals and hazards. We know that there are about 60 substances in our workplaces that cause cancer, and we suspect there are many, many more. Workers are often exposed to these carcinogens, we call them, multiple times, which increases your risk of cancer. So as research helps us understand what substances are and are not a risk for cancer, we need to ensure that employers take action to stop workers being exposed to these chemicals. For instance, the Occupational Cancer Research Centre is a partnership with the Society and the United Steelworkers, actually. The OCRC conducts research about cancer and occupational cancer and then uses these findings in the workplace to prevent exposure and improve the health of workers. We're funding a new study that for the first time will look at 44 carcinogens and their links to 27 different types of cancer in your workplace and assess how serious the problem is. We'll be able to estimate the number of new cancer cases caused by occupational exposure and the number of cancer deaths caused by exposure in the workplace. We can also work out the economic impact. And at the political level, our teams across the country are fighting for restrictions on asbestos, radon, pesticides, and other hazardous materials. We're pushing governments to protect workers and employers to guarantee a safe workplace. In fact, just this week was the end of our campaign to support a parliamentary motion to create a registry of all buildings, like homes, workplaces, and businesses, that contain asbestos. Sadly, the motion didn't pass because it was opposed by Conservative and Bloc MPs. But we won't give up. The first step to protecting yourself is being informed. You have a right to know if there is asbestos in your workplace. As many union locals have discovered when they enter collective bargaining, the employer sometimes looks to roll back hard-won provisions like sick leave, drug benefits, and disability pay. I don't know if that sounds familiar to anyone. To be clear, we need to extend these rights, not chip away at them. We need to make sure every Canadian can access the drugs they need without financial hardship. We need better sick leave and more support for people with chronic health conditions. Unions fought for these rights, and we want to help you extend them. Can you guess the average cost of a course of cancer drugs? Picture a number in your head, like a few thousand, maybe even $20,000. The average cost of one course of cancer drugs is $65,000. That's more than the average household income. If your employer has cut your benefits program, or your insurer refuses to pay out, how are you supposed to recover that cost? If you've been laid off or your company's gone bankrupt and you find yourself at the back of the line, how do you afford $65,000? Last year, I spoke to a man from New Brunswick. He emailed because his wife had just been diagnosed with cancer, and he was told that to start treatment, they'd need to pay $12,000, and they could expect to pay this amount every 2 months for the duration of her care. He simply didn't have the money. What do you say to somebody in that boat? We shouldn't have to tell people to sell their houses, to move to another province, or to choose between food and medication. A few years ago, I worked with a wonderful woman from BC. Natalie was diagnosed with breast cancer and went through several rounds of chemotherapy and radiotherapy. But after 15 weeks, her time off work and her EI support ran out. But Natalie was still too sick to go back to work. She was still recovering, and she could barely lift her head. But the money had run out, so back to work she went. And how about caregivers? We know that the bulk of caregivers are women, many of whom are supporting an elderly parent as well as their own child, not to mention holding down a job. A quarter of Canadians have cared for a sick family member in the last year, and nearly half have had to use their personal savings to do that. Like Laurie. Laurie's a mom of 3 from Ontario. When they were just 10 months old, one of her twin boys was diagnosed with cancer. Throughout Brock's treatment, Laurie was her son's caregiver. She attended every appointment and sat by his bedside for months. She was forced by her employer to give up work for her son. The family simply couldn't manage without somebody there with Brock at all times. So she was forced out, and the small payments soon added up. The gas for the long drives to hospital, the parking charges and the overnight stays. On only one salary, the family was at breaking point. So together with other charities, we've been calling for better financial support for Canadians who are sick. We're urging the federal government to improve job protection and employment insurance for workers and caregivers. We need better and more affordable access to medications. And working together, these are issues we can tackle. You know, they're issues we can't afford not to tackle. It's rare that one organisation can affect change on its own, though. And that's particularly true in this environment today. So it's by standing side by side, by raising our collective voices in solidarity, that we make change happen. And change starts with learning. The Canadian Cancer Society wants to learn. We have much to give, like world-class research and on-the-ground services, but we know unions have led the way too. You've broken the ground ahead, and you've made it easier for the rest of us to follow in your path. And just to finish, I used to work for a wonderful man who sadly passed away from cancer a year or so ago. And he used to close his meetings with a quote about improving the lives of Canadians, about improving the lives of workers, families, and patients, and future children. He would quote the late, great Tommy Douglas. "Courage, my friends, 'tis not too late to make a better world." Thank you.